Good afternoon, all. Welcome to yet another live show with us at Specialist Hospital. Today we are back with another interesting topic which you should all well be aware of, diabetes mellitus. What are the do's and don'ts and the early signs that you need to recognize. Joining us today on our live session, we have Dr. Kanchan, consultant physician and diabetologist, Specialist Hospital Bangalore. Welcome, Dr. Kanchan. Let us start off with what is diabetes?
Good afternoon to one and all. I hope all of you are doing well and keeping safe, especially with the ongoing pandemic. So coming to our today's discussion, diabetes. So what is diabetes? So it's very difficult to define what is diabetes in a sentence. Diabetes is the most common chronic disorder known to mankind. It's an endocrinological disease. It was discovered way back in 1500 BC, in the time of the Greeks. Our very own Sushruta and Charaka, they have described diabetes called Madhumeh. And it got a big importance in the 1880s when the pancreas was discovered by Mehring. And in 1922, when Banting and Best discovered insulin, from then, diabetes has been the superstar of all chronic disorders. So in diabetes, we have basically elevated blood glucose levels due to various reasons. So this is what we see day in and day out in our clinical practice and in society at large.
Thank you, Doctor. That was a very good introduction about the history and awareness for all of our viewers. What are the types of diabetes mellitus?
In clinical practice, we see mainly two types of diabetes, type 1 and type 2, which is very, very common. All of us have heard about type 2 diabetes. The less common types are gestational diabetes, the kind of diabetes we see in pregnancy. We also have a type called MODY, maturity onset of diabetes in the young. And last but not the least, diabetes with endocrinological diseases, be it pancreatic problems, be it hemochromatosis, be it Cushing's, be it adrenal disorders. We can see diabetes associated with these conditions as well.
What is prediabetes and how important is it to identify?
So prediabetes is that phase which the patient is right before the full-blown symptoms or the full-blown effect of diabetes comes out. So over here, patient can have very mild or vague symptoms associated directly or indirectly to diabetes mellitus. It is very important to identify prediabetes because we can have preventive measures come in fast at this phase, and that can make a huge difference in the overall health and the well-being of the patient.
When we speak about diabetes, there are signs and symptoms. What are the classic symptoms of untreated diabetes?
The classic triad of diabetes, what we have heard day in and day out, is weight loss, polyuria and polydipsia. That is, the patient may feel extremely thirsty, the patient may feel extremely hungry. So this is the classical triad of diabetes. However, of late, these signs and symptoms are seen much later, generally when the glucose levels have crossed 250. Because of increased awareness and increased concern about health, and the regular checkups that have been a norm in nowadays, they are identified before the classic triad is started or is discovered by the patients. Of late, in clinical practice, we see recurrent urinary infections being one sign which makes the patient come to the OPD. We see recurrent boils, recurrent skin issues, which bring into notice that the patient suspects he may have diabetes. Sometimes we see severe joint pains, we see neurological issues, we see severe body ache, tiredness, weight loss also, which may have an alarming sign, and the patients may suspect themselves to have diabetes and they go for these investigations.
Thank you, doctor. What are the alarming symptoms where a patient has to rush to the hospital?
So there are some symptoms which we have to keep an open eye for. It can be severe fatigue, severe unexplained fatigue. It can be confusional state. It can be drowsiness unexplained by any other reason, or it can simply be irrelevant talk. It can be dehydration. So these are the red flag signs which I would like to highlight. In case you see this in yourselves or you see it in your near and dear ones, especially in our elders, so we need to be a little alert. Any of these signs, please rush them immediately to the hospital.
Once a patient is diabetic, there would be complications. So what are the long-term complications of diabetes?
The basic reason of diagnosing diabetes is not only about the sugars. It's not only about two numbers, what is my fasting, what is my postprandial. The whole reason of why we are so concerned about diabetes is they have a huge impact on the overall health. They have an impact on the entire body. Almost every system of the body is affected by diabetes. This takes a toll not only on the individual health but also on the economic and the personal and professional lives of every person in our society. When we talk about long-term complications, it can involve almost all the systems from head to toe. Coming to the nervous system, you can have strokes, high incidence of strokes. You can have the eye being affected, where we have diabetic retinopathies, we have high incidence of cataract. We can have the heart, the cardiovascular system being involved with high incidence of myocardial infarction and peripheral vascular diseases. We can have the gastrointestinal system go for a toss. We can even have the kidneys involved, most commonly called as the diabetic nephropathy. We can have the nerves of the patient being involved, which actually troubles the patient day in and day out for very long terms, where we call it as diabetic neuropathies and so on and so forth. So there are umpteen number of long-term complications. There are high risk of recurrent infections, be it genital infections, be it respiratory infections. So these are the most common long-term consequences which we come across day in and day out.
Thank you, doctor. What are the consequences of diabetes if left untreated?
So in case we leave diabetes untreated, we know that we are diabetic and we keep either postponing a visit to a doctor, or we just feel that I don't have any major symptom, I'm feeling okay, why should I treat? Why should I go for treatment? It's quite a dangerous decision. Apart from the long-term complications we just spoke about, there are more dangerous and fatal complications, which are the acute complications. In the acute complications, we can see hyperosmolar states, we can see diabetic ketoacidosis, or we can see hypoglycemic states, which can be fatal. They are unforgiving and can be fatal, give us very little time to react, and the patient loses his life as well. Apart from this, the long-term slow killers are all the long-term complications we just spoke about, be it nephropathy, be it neuropathies, be it the retinopathies, or even the cardiovascular complications. They can also be fatal and can cause long-term mortality and morbidity as well.
So diabetes and pregnant women, how do we diagnose a diabetic patient when the mom is actually pregnant?
I would like to use this opportunity again to bring in our notice another very important concept of diabetes in pregnancy. It is very important to screen all our diabetic ladies as soon as possible when the pregnancy is discovered. Diagnosing diabetes in pregnancy is not only important for the mother's health, it is also important for the fetus's health as well. So here we are talking about more than a life here. Diabetes causes a lot of complications in pregnancy. be it the weight of the baby, be it the placental complications, be it amniotic fluid complications. It can cause heart defects in the fetus, it can cause birth complications, and so on and so forth. So a simple test called an oral glucose tolerance test is performed in all our diabetic ladies as soon as possible in regular antenatal checkups. And based on the oral glucose tolerance test, they are screened into if they are for a high risk of developing diabetes, if they are in impaired glucose tolerance states, or if they have a family history of diabetes. So all the high risk groups are screened right at the first trimester, and followed by which we can go ahead with regular glucose checkings pre-meal and post-meal, and the HbA1c monitoring as well.
Once a person has high blood sugar level, what are the do's and don'ts that they should follow?
So once you're diagnosed to be diabetic, you're labeled diabetic. So this takes a toll on your mental health as well. Suddenly being termed as diabetic can cause a lot of agony, it can cause a lot of stress, and you can suddenly feel that my life has changed forever. So that is not the state at present. The past 5 years has revolutionized the treatment of diabetes and how we manage and look at it. So diabetes should not be treated as a punishment. You should not feel that now everything would look like a punishment. I cannot eat so many things. I cannot live my life normally. It's not so. The do's and don'ts of diabetes more or less should we should more or less focus on how we will alter your lifestyle and not make it too punishing or not make it too extreme. It's very important we focus on the diet, focus on including complex carbohydrates, focus on switching your cereals regularly, focus on having short and frequent meals, increase your fluid intake daily, and get a good exercise of at least 20 minutes, 5 days a week. It can be any exercise of your liking. You can jog, you can brisk walk, you can cycle, you can swim, whatever you like, but get regular physical activity. Also, I would insist on the importance of good rest. A good night's sleep is also very, very important. And take care of your general health also, the feet, the skin, and all of that. Now, what are the don'ts? So, sugar-rich food, wherein we are talking about direct sugar, be it caster sugar, be it any of the alternating sweeteners. There is a general tendency, if you are diabetic or if you are having a tendency of developing diabetes, so we generally go for jaggery, we go for honey, we go for those kind of sweeteners. I would say no to them as well. So go for safe sweeteners. The safest of late is stevia, or erythritol. You can go for these sweeteners. They are very, very safe and they do not cause increased glucose load. On the other hand, I would also insist on regular eating habits. Do not miss your meals, however busy you might be. Avoid fasting, I would say. Now that we have our festivities around the corner, I would insist, in case you are diabetic, don't fast as much as possible. We would avoid fasting states because they have a huge impact on diabetic health as well.
Thank you, Doctor. Since you have mentioned food plays a major role for the do's and don'ts of diabetic patients, can one get diabetes just by eating sweets, or there are other factors that are involved?
I wish it was that simple. Yes, coming to the answer, only by eating sweets, one would not become diabetic. Of course, it is a multifactorial disorder. The genetics play a huge role. Your lifestyle plays a huge role. Your stress factor plays a huge role. It is an amalgamation of all these factors which tend to land you up in being a diabetic or being a pre-diabetic or having an impaired glucose tolerance. So if you are having a sweet tooth, always keep an eye on your sugars. That is one tagline I would like to give along with this query.
Thank you, doctor. Is it true that diabetes can be passed on generation to generation, and is it actually hereditary disease?
Yes, diabetes has a huge contribution from genetics. So be it type 1 diabetes or type 2 or MODY or even gestational diabetes for that matter, we have seen that a lot of genetics play a role. So many genes are involved in this, be it the HLA or the HLA factor or the DR genes, and you have so many alterations in the genetic sequences which make one prone to get diabetes. If one of your parent is diabetic, you are under almost a 25 to 33% chance you may land up to be a diabetic. And if both your parents are diabetic, then it just quadruples. The risk of you being diabetic quadruples. Twins, they have, we see a sequence where it repeats in them as well, siblings, and they also, we see a pattern where there's a hereditary contribution definitely for the incidence of diabetes.
So people who have parents with diabetes have to take extra precaution and caution when they manage their diet and exercise.
Absolutely.
Yes. So while we talk about the condition of diabetes, can there be complete cure from diabetes?
So diabetes being a multifactorial disorder, we never get to the cure of it. And because genetics plays a huge role, it's very, very difficult or next to impossible to use the term cure. Definitely, what kind of a diabetic you will turn out to be? Will you be a diabetic who takes 1 tablet a day? Will you be a diabetic who's not taking any medicine at all, who is just doing it with lifestyle change? Or will you land up to be a diabetic with multiple insulins and multiple tablets a day? Solely depends on what kind of medications you're put on, what advice you have got, what information from reliable sources have you received, and most importantly, what's your attitude towards diabetes and what lifestyle measures you have incorporated in your day-to-day routine. Yes, if you have looked into all these aspects, I wouldn't call it cure, but I would definitely say you could get it down to a very, very, very manageable level, or you could keep it to the minimal possible kind of a situation. Getting it under control or getting it to almost a near normal status is very, very much achievable. But curing, I wouldn't use the word curing.
That is very hopeful for all our diabetics and those who are at risk. So is it true that once treatment starts, it carries on as lifetime treatment?
This is the most common query we get in the OPD basis. Doctor, you're going to put me on tablets. That means I'll have to just pop pills all my life. Is that true? Definitely not. Okay. No doctor will put you on diabetic treatment, be it the tablets or the insulin, if it is not required. In case your A1C levels go back to the near normal status, you start getting hypoglycemic symptoms, we can take you off diabetic medications, which is why we encourage people to take treatment at the right time. It's better to take treatment early on rather than keep postponing treatment, keep avoiding treatment only for the fear of being on medications, which is not true. It is one of the biggest myths associated with treatment of diabetes, and because of this, the disease burden increases year and year and year. It puts a huge strain on the families, it puts a huge strain on our economical well-being of the society. Please don't restrain or restrict getting help, getting treatment for diabetes only for the fear of being on pills all your life. It is definitely not true.
That is very reassuring as well. How do we manage diabetes?
Yes, most important is lifestyle measures. Like we have discussed, be as active as possible, Get good rest. Good night's sleep is very important. Focus on your food habits. In case you are confused about what to eat, what not to eat, please take the help of a good dietitian. We have umpteen number of them around us, nutritionists and dietitians who are willing to help you round the clock. And yes, you have to start off with medications whenever it is indicated, as per the clinical decision of your diabetologist. Apart from that, spread awareness around you and look at healthy options for food. If you are having a sweet tooth, reach out for safe sweets. It can be a sugar-free preparation. It can be a preparation with a safe sweetener like stevia. Do not restrict yourself to such an extent that you feel life is nothing but like a punishment. So these are all the steps you take to counteract diabetes.
Finally, for our viewers, what would be your take-home message?
So, the pandemic that gets discussed of late is COVID. I would call diabetes mellitus the evergreen pandemic. We have 79 million people who are affected with diabetes in India, and every year the number only increases. So my take-home message would be, focus on your general health, get tested early, keep an eye on your sugars, and don't hesitate to get treatment at the right time.
Thank you, doctor. That is very reassuring, and our session was informative for our diabetics as well as those at risk for diabetes. Thank you, viewers, for this afternoon. Join us again soon for our next session, which will be announced shortly. Thank you.